How to use a metered dose inhaler with a valved holding chamber, also commonly referred to as a spacer. Check the dose counter on the inhaler. Do not use it if it says 0. 0 means the inhaler is empty and needs to be replaced. Prime a brand new inhaler before using it for the first time. This prepares the inhaler for use. Prime the inhaler by shaking for 10 seconds and spraying 2 or 4 puffs into the air based on your medicine instructions. Prime again if you have not used this inhaler for 1 to 2 weeks or have dropped it. To take a dose, shake the inhaler to mix the medicine. Take the cap off the inhaler and make sure the mouthpiece and valved holding chamber are clean and there is nothing inside the mouthpieces. Place the inhaler mouthpiece into the open end of the valved holding chamber. Remove the valved holding chamber mouthpiece cap. Prepare your body by sitting or standing up straight. Breathe out all the way, away from the holding chamber. Hold the inhaler with your pointer finger on the top of the inhaler and thumb on the bottom. Tilt head back slightly. Put the mouthpiece of the holding chamber into your mouth above your tongue. Close your lips tightly around the mouthpiece. Press down on the top of the inhaler once to release the medicine and begin to breathe in through your mouth. Keep your lips closed around the mouthpiece. Breathe in for 3 to 5 seconds using one deep and steady breath to pull the medicine into your lungs. If the holding chamber whistles, you are breathing in too fast. Remove the chamber from your mouth and hold your breath for up to 10 seconds. Breathe out slowly through your mouth. Repeat these steps in 1 minute if using more than 1 puff. Rinse your mouth with water and spit it out. Replace the cap and store in a cool, dry place. Clean your inhaler, chamber, or spacer according to their package instructions. If you have trouble using the inhaler correctly, ask your pharmacist or doctor for help.